In this section of our lecture, now we will discuss the chronic pharyngitis. We talked so far about the pharyngitis, acute pharyngitis, how the patient with acute pharyngitis present, and what are the different etiologies or causes of acute pharyngitis. And now we will discuss the chronic pharyngitis, when the pharyngitis that is recurrent and that is present for a long duration, that's the chronic pharyngitis. What are the causes of now chronic pharyngitis? How the patient with chronic pharyngitis present, and then how we diagnose and treat the chronic pharyngitis. So chronic pharyngitis is the chronic inflammation of the pharynx, and now you can see in the first acute pharyngitis we notice there is the redness and there is a congestion of the throat or pharyngeal area, but here you can see as it becomes chronic, it's more and more like even more hypertrophied or swollen area. So two types of chronic pharyngitis. We have chronic catarrhal type, and then we have chronic hypertrophic granular type of chronic pharyngitis. And it is characterized by hypertrophy of mucosa. Very good picture on clinical examination how the mucosa of the pharynx is hypertrophied. Hypertrophy of seromucinous glands, subepithelial lymphoid follicle hypertrophy, and there is muscular coat of pharynx hypertrophy. Now the pharynx or pharyngitis is chronic pharyngitis. It's present for a long period of time, and with the time there is hypertrophy, and you can see it is characterized by the hypertrophy or increased cellular proliferation or growth of all these structures, including mucosa, seromucinous gland, and lymphoid follicles, and also the muscular coat of the pharynx. They are all hypertrophy and give the presentation of the chronic pharyngitis. Etiology is now the infection in the neighborhood of the pharynx, like rhinitis, sinusitis. Etiologies, you will notice they are more or less the same as for acute pharyngitis or the nasopharyngitis. Any infection in the neighborhood area can spread to the pharynx, but the condition lasts for longer period of time and it's more recurrent infection. So chronic rhinitis and sinusitis, not the acute sinusitis and rhinitis. Discharge trickles down the pharynx, hypertrophy of lateral pharyngeal bands, there is chronic tonsillitis and dental sepsis. Mouth breathing occurs with the chronic pharyngitis. All these causes that leads to chronic pharyngitis, there is problem in the breathing. So patients usually try to breathe by the mouth. So mouth breathing is present, which cause exposure of the person to unfiltered or air. Our nasal cavity is they have the ability to filter the air we breathe. So when there is nasal obstruction, then the patient try to breathe from the mouth, and this leads to exposure to the unfiltered air. And there is obstruction in the nose as a result of the polyps. Obstruction in nasopharynx, adenoids, all these factors can lead to mouth breathing. Protruding teeth also cause mouth breathing. Habitual without any organic cause. Chronic irritants like excessive smoking, heavy drinking, highly spiced food, some environmental pollution like smoke, dusty environment, irritants in the industries. Then we have pharyngeal neurosis. All these are the causes of chronic pharyngitis that leads to the exposure of the pharynx over prolonged period of time, leading to chronic infection or inflammation of the pharynx. In the pharyngeal neurosis, if we have in faulty noise production also, hawking or snorting is present also. Hypertrophic. Some symptoms of chronic pharyngitis is discomfort or pain in the throat. Foreign body sensation in throat is very commonly associated with chronic pharyngitis, and it's very irritating. Patient feels that they have something, some foreign body is present. They want to expel it out by coughing and different means, but it stays there, and that's the sensation present in the throat. Tiredness of the voice, coughing, and retching or gagging. All these are the symptoms of chronic inflammation of the pharynx or chronic pharyngitis. Some signs are of chronic catarrhal pharyngitis. There is congestion of posterior pharyngeal wall. Catarrhal pharyngitis is congestion, very red, swollen back of the throat, posterior pharyngeal wall. On examination, that's characteristic of catarrhal pharyngitis. Engorgement of blood vessels, fascial pillars may be thickened, and there is increased mucus secretion. So in catarrhal type of pharyngitis, there is congestion of posterior pharyngeal wall, engorgement of the vessels, thickening of the fascial pillars. All these are present. Signs of chronic hypertrophic granular pharyngitis. We mentioned that chronic pharyngitis is of two types. We have catarrhal and then we have granular type. And here if you see, it's the granules present on the back in the pharynx. So that's the granular pharyngitis. As compared to catarrhal, the whole area was very congested, engorged and red. So this is the hypertrophic type of granular pharyngitis. There is thickening of the pharyngeal wall that becomes thick and edematous. Congested mucosa and dilated vessels. Posterior pharyngeal wall has reddish nodules. Here you can see reddish nodules. Hypertrophy of subepithelial lymphoid follicles. Lateral pharyngeal bands are hypertrophied, and there is also edema of the uvula. This is the uvula, and you see it's edematous and swollen. So this is the hypertrophic granular type of pharyngitis in which the granules and nodules are present on the pharyngeal wall. Treatment is by the eradication of etiological factor. We talked about so many etiological factors that can cause chronic pharyngitis. Unless there is treatment of the underlying cause, the condition is not treated. If the patient has chronic rhinitis, that should be treated first. Similarly, chronic sinusitis, if the patient has some problems that can lead to the mouth breathing, that should be treated. So the treatment of the underlying cause is important. Voice rest and speech therapy. warm saline gargles, Mandel's paint application, cautery of lymphoid granules, the big granules present that should be cauterized and destroyed, electrocautery or diathermy. So this was all about the chronic pharyngitis. Thank you for watching sqadia.com.